Now we are up and on our series on family planning methods. We talked about generally family planning methods, and we also talked about the benefits and who should use them. We group family planning method into natural and artificial methods. We also grouped the artificial methods into hormonal and non-hormonal methods. So the hormones used in hormonal methods are progesterone and estrogen. So these are the hormones we are going to be analyzing among the hormonal family planning methods. And today, we want to start with one hormone called progesterone only. So we want to cover the progesterone only pill. I know you could have heard of it or seen it. The progesterone only pill, just as it is called, contains one hormone called progesterone. And mostly it is scientifically it is called levonorgestrel, and it contains like 30 mcgs of levonorgestrel. So this hormone, progesterone, has many other functions, including maintaining a pregnancy and taking care of it, including also preparing the uterus for fertilization. But when used in that dosage for family planning, its main work is to thicken the cervical mucus. We know that there is some cervical mucus whereby sperm motility is enabled, but this time it is thickened, causing this sperm motility to be tampered with. And this is how it achieves contraception. The second thing that it does is to prevent ovulation. It suppresses ovulation. That means there will be no release of the egg, meaning that fertilization is also tampered with. So this is how this method works. Its effectiveness is quite high, especially when used at the same time every day with no missing of pills. So its effectiveness is estimated at around 99.5%. That is a very high effectiveness rate, because it means it is less than one pregnancy in 100 people who are using the same method. That makes it a very effective method, especially when used appropriately. So let us describe the appropriate use of this method, the progesterone only pill, or the POP, or the mini pill. What is appropriate use of the mini pill? Appropriate use of mini pill means that you are taking a pill every day, and at the same time is the most preferred. So you take it every day and specifically at the same time. And the moment you finish your pack of maybe 28 pills, the moment the pack is finished, you continue and open another pack immediately to start on the next day. If you miss a pill, means that you take a pill as soon as possible, but ensure you don't miss 3 pills. If you miss 3 pills or more, it is important to start all over again, and also visit your clinic to ensure or to check that you are not pregnant. So at that time, you may need to use backup methods, and backup method refers to maybe condoms or emergency contraceptive, which could give an immediate contraception. So this is the appropriateness of using this method. The other thing that we consider, or how we are using this method, the people who can use this method are basically somebody who is breastfeeding or nearly fully breastfeeding. So this means you are either breastfeeding your baby exclusively, that is before 6 months, or after 6 months, but you are still actively breastfeeding, meaning around more than 4 times a day. This would still work together with the progesterone only pill. So if you are not breastfeeding actively, or if you stop breastfeeding actively, this means you are at risk of still getting pregnant while using the progesterone only pill. Take a pill every day and ensure you have taken it at least without missing the pills. So ensure you remember. So, and this is one of the maybe limitations of the method. Any pills you have to remember every day. So it needs people who love consistency and people who are also just okay with doing something the same time every day. People who love consistency are good with the method. So we also want to see the benefits of this method. So the contraceptive benefits is that the method is quite safe. Progesterone only is usually quite safe and does not bring many undesired effects. So it is safe, and also it does not suppress breastfeeding or lactation. It does not suppress or affect a woman who is lactating. So this is very good. And that's why it is the one recommended for the person who wants to breastfeed and breastfeed effectively. You will be told not to use the combined, the one having estrogen. So use the progesterone only, because it also supports you as you continue breastfeeding. So this method has many contraceptive effects. So it also prevents pregnancy, and we have seen it is very effective. So those are the contraceptive effects of this, benefits of this method. Very safe if used appropriately, prevents pregnancy, and also it will not suppress your breastfeeding. So this method is good, and also its effects are not very severe like for other methods. So we want to see some of the limitations. Remember, this method does not protect you from sexually transmitted infection. So if you want protection from sexually transmitted infections, you may need to use other methods that are able to do that. And if I talk of other methods, you could think of condoms. Those are the methods that could be known to prevent some of the sexually transmitted infections. So another good thing about this method is that if you want to return to fertility, it has no delays when you want to return to fertility. Although it is quite unlikely that you may want to return to fertility less than an year less than a year after delivery. So return to fertility is not delayed. So now we want to see about the side effects of the progesterone only pill. What side effects do you expect? As we have said, the side effects of the progesterone only pill have been found to be quite mild. So some of the things you may experience would be headaches. As we know, hormonal changes usually affect our body systems. So if you find yourself having headaches, get to your doctor to be given a painkiller. And then from there, you just move on and monitor the progress. So anytime you have any effect that bothers you, get to your provider or to your healthcare provider, get a solution. Let them give you a solution, because some of these things are common, but maybe there are times when they may be major and you will always be told. Another thing that you could have is menstrual irregularities. That is, you could have no period, or you could have maybe irregular period, or any other issues that you feel about the menstrual period. But if there's too much bleeding, that one also you may need to be reviewed. You may need to be checked. So always get checked when anything is severe. Even normal effects, if they are severe, always go for a checkup. Just get whether you are, maybe the method fits you and all that. But we have seen it fits 99.5% of women. So that means 0.5 is what we may be dealing with or imagining about. So another effect that you could have is the bleeding, what we have said, bleeding. If you bleed too much, just maybe get a checkup. If it is just spotting, always report something when you feel it is unusual. Another thing that you could feel is abdominal pain. So if you have severe abdominal pain, always go for a checkup. Some maybe gastric effects could be mild. Maybe they are not very common, but if you get some feeling a bit of nausea and all that, it is always good to report and maybe get checked and helped, and also given some medication. So there are some non-contraceptive benefits of this method. So it is one, this method is known to support the person who is breastfeeding. Number two, the method has been known to maybe participate in prevention of the cancer of the endometrium, and also in some way cancers of the ovaries. So this method assists in some ways. So mood changes could be positive or negative. So get to control your mood. Try control your moods maybe when you are taking this method. It is very, very important. Who should not use this method? There are a few people who could be told not to use the method, or they could be allowed to use it with caution. But I want specifically to speak about the major issues that we need to look at when taking this method. Number one, if you have any issue of the liver, that means that there are diseases like cirrhosis, hepatitis, any issue with the liver, just don't take the method. You may be asked to take another method, or an hormonal method, or even methods that do not require any to pass through the liver. So if you have any problem with the liver, just get fast to be treated, and also your healthcare provider will help you to choose another method. Another person that may need not to take this method is someone with active deep venous thrombosis, that is clots of the legs. Maybe you have been told that you have a clot on your leg. It is always important to choose another method, as your healthcare provider will guide you to get another one. Then if you have any convulsive disease like epilepsy or any convulsion disease, and you are taking anticonvulsants, this method could have a reduced action by those anticonvulsant medications. So it is important to get some help from your healthcare provider and assessment to be seen whether you can be able to use this method effectively. Remember, we want to use it effectively, so we do not want to reduce the effectiveness of this method. So if taking any anticonvulsants and some anti-tuberculosis drugs, please always report. So in simple, when you are going for the progesterone only pill or any family planning method, always report any medications that you are on, so that you are able to be advised. Also, if you have any other diseases, it's also good to report. If you have hypertension, you have diabetes and all that, let it be known so that we know, is the hypertension too much, is it too low, and all that. But progesterone only pill is good also for the one with hypertension and diabetes, and it will depend a lot on how you have been assessed. So these are the things that you check on. And also, if you have breast cancer, it is also important to be to ask your healthcare provider for advice when using hormonal methods, or specifically also the progesterone only pill. And let me correct that, it does not cause breast cancer, but if you have it, it is always important to be helped to check for a method that is more friendly. So these are the people that could be limited to use this method. Now, the last thing I would want us to analyze is, if you miss the pill, what happens? If you miss a pill. Now, if you miss a progesterone only pill, it is important to take the pill as soon as possible. So take it as soon as possible. Now, if you miss a pill now, you can take it even 4 hours later or 5, but take it as soon as possible. If you miss that pill for more than 3 days, or you miss the pill maybe 2-3 days, get checked up for for pregnancy, and also maybe restart again. It is also important to use a backup method if you have missed this pill for those 2 to 3 days. Now, and also, when you are starting the method, ensure that you have taken the pill for at least 2 days to ensure that the hormonal changes have occurred as needed. So if you have started the pill today, say for 48 hours, maybe abstain or use a backup method to ensure that you have an effective contraception. That is because if you take it today, remember the drugs that are taken already could take some time also to work and to achieve the important hormonal changes that are needed, and also to start action. So give it at least 2 days, that is 48 hours, for you to be able to say or declare that it is good for use. So this is what I have to say about the contraceptive method called progesterone only pills. So in summary, we have said it contains progesterone only, We have also said that it is used by women that are fully or nearly fully breastfeeding. And we have also talked about the side effects, which include maybe headaches, bleeding, abdominal pains, and maybe others that you could have, which can be treated if they are mild or ignored if they are not too much affecting you. We have also said that if you miss a pill, take one as soon as possible. And we have said that when you take a pill, it takes 48 hours for you to achieve the required hormonal needs. So we have also said that this method is highly beneficial in that it is safe and it does not suppress lactation. Remember that this method can only be used up to 1 year if you delivered after delivery, because after 1 year, it is usually almost guaranteed that you usually stop breastfeeding very actively because the baby feeds by themselves. If you have any question, ask it maybe on the comment section. Keep watching, subscribing, and following. Thank you very much.